As we see this new surge in COVID-19 cases, as we see the second wave of this virus, we're taking action. My friends, over the last few days, we've seen me up here every single day talking about the fall preparedness plan. We have the most robust, the most extensive plan for the second wave of COVID-19 in the entire country. We're spending $1 billion to expand testing and contact tracing. We're hiring 3,700 more frontline healthcare staff. We're clearing the backlog of surgeries with an investment of $243.7 million. And we're freeing up hospital beds. And most importantly, we're protecting our most vulnerable. Today, we're announcing further action to protect our seniors, an additional $540 million to protect our long-term care homes from COVID-19. That's more than $500 million we're spending when we're sparing no expense. This funding includes $405 million to help homes with containment measures, staffing supports, and purchasing additional supplies of PPE. $61.4 million for renovations in the homes to improve infection control, including ventilation and isolation capacity. $30 million for additional infection control staffing and training for existing staff. And we'll ensure every long-term care home has a 2-month supply of PPE. We have to take action now to protect those we care about most. That's why we have to make changes to the visitor policy for long-term care homes. We're looking at this highest risk regions, the areas with high community spread. We're working with the Chief Medical Officer to identify those areas based on the data. My friends, this is not something that we take lightly. I know firsthand how hard it can be, but it's absolutely necessary. We can't let COVID-19 get into these homes. It's absolutely critical. That's why, as of Monday, October the 5th, visitors to long-term care homes in these areas will have to be restricted to staff, essential visitors, and essential caregivers only. But folks, we have made it possible for family members or friends to come in as caregivers. This kind of support is critical, and I encourage family members, friends, please sign up to be a caregiver.
To ensure our long-term care homes are prepared to contain and prevent COVID-19, I'm pleased to announce our government's long-term care preparedness plan, which, as the Premier mentioned, includes new investments of over $500 million to support our long-term care homes. That includes more funding to help homes with operating pressures related to COVID-19 prevention and containment measures, minor capital repairs and renovations to improve infection prevention and control, and the recruitment and training of additional frontline staff. Community paramedics have done outstanding work during this pandemic. They have run testing centers, provided support in our long-term care homes, and provided countless support in other activities. Building upon these successes, we will be making an investment in community paramedicine to help those on the long-term care wait list stay in their own homes longer, where they want to be. Our personal support workers have always and will continue to be the backbone of our long-term care homes and broader healthcare system. Our government is also expanding the pool of available PSWs and registered clinical staff through several incentive programs that will see the addition of over 2,000 healthcare workers join our long-term care homes. As the Premier has said before, we will continue to act to keep Ontarians safe, especially our loved ones in long-term care.